6 more deceased COVID-19 persons were buried in Accra on Thursday, bringing the total number of interred victims in Accra to 43. GBC News' Clara Blano was with a team of environmental health workers and reports that what makes the process daunting is the inadequate logistics for the team, which in a way puts the lives of such environmental health workers at risk. And for those who still do not believe that the coronavirus exists, here are excerpts of Thursday's burial ceremony at Awudome Cemetery here in Accra.
With a team of 20, these are the men responsible for burying COVID-19 casualties in Ghana. Their work began on May 5 and so far have buried about 40 COVID-19 deceased persons. Preparations start from the old offices of the Accra Metropolitan Assembly, ensuring that every material needed for a hitch-free burial process is ready and available. To my surprise, more than 10 of the team members crammed in the buckets of this pickup, ready for action, and I'm told that has been the routine for close to 2 months now. Of the 6 persons for burial, 3 were picked from the Ridge Morgue, 2 from 37 and 1 from Kolibu. Though there are about 52 more COVID-19 dead bodies, only the 6 booked for the day were laid to rest on Thursday. I discovered the bodies were conveyed in a public hearse paid for by the deceased families, meaning any member of the public could later rent these hearses for use. For Thursday's burial, there were 4 males and 2 females aged 36, 43, 70, 71 and 77 years. Constant disinfection with a concentrated chemical of 0.5% chlorine is carried out to leave no traces of the virus behind.
All infectious bodies have a different way of burial. The moment you pass on, and the doctors give a report that you pass on based on the COVID-19 virus that has caused your death, they immediately at that time put you into a body bag, a treated body bag. And before we get to the morgue, you are already in a body bag. And we also move with additional body bags. So every body that we brought here is in 2 body bags. One was already kept at the morgue. We add another body bag to it, making 3. This is to ensure and prevent further infections after burial.
Today, there is still a lot of apprehension surrounding bodies of persons who succumbed to the coronavirus. And for these workers, duty called and they responded swiftly, but authorities are not providing the needed tools for their work, and thus frustrating their efforts.
Our low morale is the lack of resources that will help us to do the job. You can see that we are struggling and squeeze ourselves in no any other means. I myself, who supervises and manages the burial, have to sit in one of the hearses because we have no means of transport. Nothing is there to support us in the burial. And all our appeals to the state, whoever matters, our documentation and our appeal has gotten to them. We are appealing today again. This is the 4th time. The President, His Excellency, President Nana Addo Dankwa Akufo-Addo, he is a listening president. We are his children. We are Ghanaians. And we are citizens who have responsibilities equally like other people. And we are exposed to this work with the risk associated with it. And they left us to our fate.
Among the 6, 5 were Christians and 1 Muslim. My concern was the reused coffin by Muslims to convey dead bodies and then back to be used by any other person.
From the onset, before they brought the coffin to the mortuary, we made sure everything in the coffin was empty. We disinfected it with the 0.05 chlorine. Okay, that has already taken care for 0.05 chlorine. That has already taken care of the coffin from where it was brought from. after putting the body inside, the same disinfection has been carried out on the coffin. After bringing the body out, the same thing is carried on. The haze from point of entry, any touch level where we suspect human beings touching, we adequately disinfect it. Because we are constrained with logistics, we have prepared an action plan which includes this. We requested to develop 2 or more Muslim burial coffins because they are transit coffins. The budget is not approved. Who is holding it? We don't know. If we get it today, the next burial, you come, we will design the coffin, COVID-19 burial coffin.
The environmental health officers under the Public Health Directorate of the AME say they may be forced to stop work if their request for more equipment is not met.
We wrote to the headquarters and we were told that we should start since the death toll was going high. While they get us the others. So they started providing us with the PPEs. They said we should start managing with the 1 car we have so that they will add the rest. When the management becomes enough, I think we may force to put our tools down because our health is also important.
And at the cemetery gates, these words of caution hold true for all. Even those who still doubt the existence of the virus and are calling its bluff by disregarding the WHO protocols. Quote, remember, we were like you, unquote. For GBC News, Clara Mlano reporting.